And welcome to the Dr. Bob Show. We'll spend most of this show talking about how to prevent heart attacks and strokes, leading cause of death in the United States. Is your blood pressure a little high, maybe just one time? How about your cholesterol? Was it borderline? What's your family history of cholesterol? Are you overweight? Is your weight slowly increasing? Is the weight around the trunk? Do you manage stress well? All of these things are what we call risk factors for heart attacks and strokes. My guest is Dr. Dan Ely. Dr. Ely is a board-certified internal medicine specialist, is on the teaching staff at the University of Tennessee Medical Center. He'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about what are triggers for asthma and chronic obstructive pulmonary disease, and, if we have time, the difference between diverticulosis and diverticulitis. One's a lot more dangerous than the other. Do you know which one it is? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Dan Ely, board-certified internal medicine specialist on the teaching staff at the University of Tennessee Medical Center, and we're going to talk about preventing heart attacks and strokes. Dan, do you think that welcome to the Dr. Bob Show.
Thank you. Thanks, Bob.
Do you think we can help prevent, in some people, heart attacks and strokes?
Absolutely. No question about that.
So there's things that we can do. Tell me, just briefly, what is a heart attack and a stroke so we'll know where we're talking about?
Okay, heart attack means damage to the heart, usually because there's not enough blood flow to a certain area of the heart, which may die. And stroke, similarly, is damage to the brain, either because there's been bleeding, but more often because blood flow has been interrupted in a blood vessel because of a clot or something.
So heart attacks and strokes, are there risk factors? And that's what I want to talk about. What are some of the risk factors in general?
Absolutely. Well, some of the risk factors you can't do anything about, and that's being a man, unfortunately, getting a little older. That doesn't apply to you, but that's one you can't do anything about. And your family history you can't do anything about either. You know, you can't choose your parents, but you can do something about what your blood pressure is, what your cholesterol is, what your weight is, how fit you are, and whether you smoke or not.
So there are lots of things that we can do. Do you think if we corrected all of those, there would be 20% less heart attacks and strokes, or 50%? Got a feel for that?
I think there'd be, you know, we're seeing fewer deaths from heart disease. We're doing a good job. People are doing a good job at taking care of themselves better than they used to, but we've seen the rates of cardiovascular disease deaths decline, but it could decline more. I think at least another 20%.
So let's talk about some of the risk factors. Let's talk about high blood pressure. What's a normal blood pressure?
Well, it kind of depends who you ask. That's an interesting question. We used to say 140 was high blood pressure, but a lot of people now are focusing on 130 on the upper number, the systolic, or 80 on the lower number, the diastolic, as being the threshold at which we should start thinking of as high blood pressure.
So if somebody walks into your office, they're 10 pounds overweight and their blood pressure is 145 over 72, and they say, well, Doc, I just rushed in here today. My blood pressure is normally better than that. What do you tell that patient?
Well, there may be some truth to the I just rushed in here, because we don't always measure blood pressure as accurately as we should. And we want people to check their blood pressures at home, and we want to recheck them in the office and let them rest and recheck. But the first thing I tell that person is start being more physically active, cut salt and sodium down in your diet, and especially if you can lose some weight, that's going to help that blood pressure.
So those things will help reduce the blood pressure. Why does a high blood pressure make people have a heart attack or stroke?
Well, because the heart has to pump against the pressure in the arteries. It's just like pressure in your water pipes. The heart's a pump. And the more pressure there is in the pipe, that's the blood pressure, the harder the heart has to work.
So the heart has to work harder, it needs more nourishment. If the blood vessels are not doing what they should to nourish the heart, you can have a heart attack. How about stroke, the ischemic stroke that you talked about?
Okay, ischemic strokes occur because something closes off an artery in the going up to the brain, and blood flow to that part of the brain is lacking, and that causes damage. And high blood pressure is, that and smoking are probably the biggest risks for having stroke. And we know that if we can lower the blood pressure, we reduce the risk of stroke.
Are there good medicines in lowering the blood pressure?
Oh, we've got all kinds of medicine. I tell people regularly, we'll get your blood pressure down. Now, we may have to navigate and switch off depending on what side effects you might experience, because any medicine can have side effects, but almost always we can get the blood pressure down with minimal, reasonable side effects.
So high blood pressure, now let's go to cholesterol, lipids. Where do they fit into this?
Lipids are very important as well, probably a little more important from the heart attack standpoint as from the stroke standpoint, but important in both cases. And I always want to start with that lifestyle thing. Diet should be appropriate, which means, and there's lots of diets out there, and I'm not saying there's one diet that's the best for everyone, but varied, lots of fruits and vegetables, whole grains, low in saturated fat. Most people would say that's an appropriate diet to be on. And then weight is very important here in terms of being able to lower cholesterol and especially triglycerides.
So how does the cholesterol cause hypertension or high blood pressure or hardening of the arteries or strokes or heart attacks?
Yeah, I wouldn't say that cholesterol causes high blood pressure, but it certainly leads to hardening of the arteries over time, because cholesterol can deposit inside the arteries, which then become calcified and hardened, and then that directly can elevate blood pressure. So those two things go together.
A lot of things are going together. So we're having cholesterol, lifestyle activities help bring things down. What about, when we're talking about cholesterol, how about triglycerides?
Sure. Triglycerides are a different blood fat than cholesterol, and it's a way the body packages fats, especially right after you've eaten. Triglycerides are very, first of all, genetically determined, so you can, again, thank your parents. But you have a lot to do with what your triglyceride level is, and cutting down sugars in your diet and starchy carbohydrate, the white things, white bread, pasta, potatoes, that will lower your triglycerides a lot. And I know I sound like a broken record, losing weight lowers triglycerides.
Now, that's a key to everything, isn't it? Watching how much you weigh, and so the body fat distribution doesn't start leading toward hypertension, elevated cholesterol, hardening of the arteries,
Yes.
ad nauseum, but it ends up causing problems later on. What age should we start measuring? We discussed this earlier. It's a difficult question. You know, how young?
Right.
Because I think pediatricians sometimes start measuring cholesterol at an early age.
I think that's true, especially if there's a family history of high cholesterol. In my practice, I don't see children, but I would like to know what the cholesterol values are by about age 20.
Can you what do you do to bring the cholesterol down? If somebody's got a high cholesterol, there's good medicines for it, and there's lifestyle changes of exercise and eating properly. So what do you tell patients?
Well, we're going to almost always start with those lifestyle things. And, you know, I've talked about weight loss. Sometimes people aren't overweight, but fitness is important in helping to improve the ratios of the good and bad cholesterol and lowering triglycerides. So being fit, being physically active is where we're going to start. If we need medicine, those are wonderfully effective at lowering cholesterol.
So the medicines in general that help lower cholesterol would be what?
Well, the statin group of drugs are the ones we've used for many years now, and we have lots of accumulated evidence of their effectiveness. And they're inexpensive, they're generic, and they're typically very well tolerated, and they're very effective.
So far, we're saying there's a lot we can do to prevent heart attacks and strokes, so we can keep the blood pressure under control. As you say, the medicines will get your blood pressure under control. Now you need to start exercising. And then we've got our lipids, cholesterol, we've got statin drugs, we've got lifestyle changes. Are there other risk factors that we need to work on?
Well, I briefly mentioned smoking, but smoking is always a key.
And that's what we're going to be talking about when we come back. We're going to talk about smoking, about your blood sugar being elevated, about you're becoming obese and how dangerous that is. And what do we have to do to improve those things so we won't have heart attacks and strokes? A lot of information. I can't wait. We're talking with Dr. Dan Ely, board-certified internal medicine specialist on the teaching staff at the University of Tennessee Medical Center, and we've been talking about, can we prevent heart attacks and strokes? No question about it. There are things that we can do to prevent. Those are called risk factors, and we've talked about high blood pressure. It's easy if you get a regular treatment program with your doctor. And then we talked about cholesterol. There's increasing your lifestyle changes. There's the statin medications. And before we leave that, there's one newer medicine in the horizon for lowering cholesterol. What's that?
Well, it's a group of medicines, and they're called the PCSK9 inhibitors.
PCSK9.
PCSK9, and don't ask me to tell you what that means, because don't embarrass me. But
these are injectables.
These are injectables, but they're a very promising group of drugs because they really effectively lower cholesterol. And there are some people out there who don't tolerate statins well, and this may be a group of drugs that will have increasing use for that group of patients.
How often do you have to take that injection? Is it a daily, weekly,
depends.
monthly?
It's typically like every 2 weeks.
So that's good. And then, like any new medicines, there's an expense, and you have to be sure that's involved.
Sure.
So we mentioned the smoking just at the end of the last segment. How does cigarette smoking, stopping, or how does it involve the blood vessel damage and people getting ischemic strokes or heart attacks?
Right. I think that's kind of complicated, but smoking, nicotine, and other factors, other elements in tobacco will constrict blood vessels, and then you generate carbon monoxide, which is not a good thing to have in the bloodstream, and other what are called free radicals, which further can kind of damage the inside of the artery. So all those things together just are detrimental to the arteries.
So I used to think of cigarette smoke as when you smoke, the lining of the blood vessel is damaged a little bit, lets the cholesterol get in there. That leads to hardening of the arteries. That leads to strokes. That leads to heart attacks. It's all sort of put together, isn't it? It's just not one thing that's doing this.
Absolutely. It's like a bit of a cascade that happens. But the good thing is you can reverse that cascade by stopping smoking and attending to the other risk factors that you've been talking about.
What about if somebody else in the house is smoking? Does that bother the other people's health?
I hate to say it, but yes, secondhand smoke is not a good thing. It's not as bad as firsthand smoke, but it's certainly not benign.
So if there are people smoking in the house, we need to do a better job in helping people stop smoking.
Yes. Quitting smoking is very difficult, as you know, and you can't just expect people are going to quit easily, but they shouldn't be smoking in the house, I would say that.
Nor in the car.
Nor in the car.
Well,
yes.
I roll down the window. I always clap my hands and say, just don't do it. You have to stop the car, get out of the car. So let's talk about sedentary lifestyle. What does sedentary lifestyle mean?
Well, it just sounds like what it means. It sounds like you're sitting on the couch too much. We need to be up and moving, and being active. Really, that's just the key.
So how active do we need to be? And you know, some people will say, I just don't feel like getting out, and there's always an excuse. Okay. So how do you guide people toward more activity, Dan?
Well, I try to help them remember all the good things they feel when they're active, because people will admit they feel better physically, they sleep better, they have better energy, their bowel function is better, their sex life is better, it's all better. But they kind of forget that as they get more sedentary. And you know, we've done I think a bad thing in the past about telling people you have to exercise for this many minutes, this many times in the week. And I think a lot of people that see that as a mountain they can't climb. But any activity is good. And what you need to do is start slow and start small and build up.
What about no pain, no gain? You know, you got to exercise till you're hurting. Is that necessarily so?
No, that's not. Walking is great exercise, and you shouldn't hurt when you walk. And now it's not bad to stretch it and push yourself some. That's fine too. But you don't have to hurt to get the cardiovascular benefit.
Is exercise boring, or how do you make it exciting? You know, I think really you need to get a partner, you need to go to the gym, it needs to be a social thing where you're exercising. And what's the difference between aerobic and exercise where you've got to do it so much time in length?
Yeah. So I think you're hit on a key, which is if you find exercise to be boring, you're not going to keep doing it. And pushing yourself over and over is going to become something you fall away from. So find ways to break that up. Do different activities, do them with people, and do them in a group setting. And they'll bring you out. They'll help you to get out on days when you don't want to. You know, my wife walks. She walks more when she walks with a friend.
Yeah, and it's just, I'll meet you at, and so you make sure that you meet with somebody and that you do the activity. If your blood sugar goes too high, that's a wake-up call when you've got diabetes or an elevated blood sugar. What do we mean by that? Where does that stand as a risk factor?
Okay, so that's a big, big risk factor, diabetes, and unfortunately we've got a lot of it in the United States. As you know, there's two types. Type 1, which is when diabetes is when the blood sugar is too high. Type 1 is when the body's not producing insulin, and insulin is what regulates blood sugar. So that's type 1. That's the minority of diabetes. The majority, the great number, many more cases are type 2 diabetes, when you're producing insulin but not enough to keep the blood sugar under control.
What would insulin resistance be? You may be producing enough, but there are antibodies against it where it doesn't work.
Something like that. And really, excess weight is really the key to insulin resistance, because we know, if you're diabetic and you're overweight, you will have a lot to say about what your blood sugars are if you can lose weight.
So it really gets down to exercise, and weight really is weight reduction. It really has a lot to do with preventing heart attacks and strokes. What's a normal blood sugar, or what's an abnormal blood sugar?
So a fasting blood sugar, and blood sugar is one thing that should be done fasting. And by the way, I didn't mention it, but cholesterol values no longer are thought to have to be done fasting. So you can do it in the non-fasting state. Blood sugar fasting is really what we look at. And normal is 100 or less, down to 80, 70, or 80 in a non-diabetic person. Diabetes is defined as a blood sugar above 125 twice fasting.
So if you're between 100, we want it below 100, you said, between 100 and 125 twice. What's that called? If there's a level there greater than 100 but less than 125.
Right, that could be called insulin resistant, pre-diabetes or elevated fasting blood sugar. But it's not, and many people will think, oh good, I'm not diabetic. That's not the way to look at that. You need to look at it as you will be diabetic unless you do something about it.
Unless you wake up and start exercising and eating properly and sleeping well. So what I'm hearing you say is hypertension, risk factor, can be controlled. There's good medicines, but you got to be active and you got to work at it with your doctor. That if you've got an elevated blood sugar, it's a wake-up call. You can lower it by losing weight and being active. If your cholesterol is elevated, if you watch what you eat and you're active, you can help control the cholesterol. If you're smoking, you got to stop. And as you know, it's a very, very, very addictive thing. Anything special that you tell people how to stop smoking?
Well, I always try to encourage them to feel good about it, not feel bad about it, to work at it. It's a process. And to set goals. set dates when they're going to quit, when they're going to cut down, how they're going to cut down. I tell people to put a mason jar on their table and put $5 in there every time they didn't smoke a pack of cigarettes, and put a list of things they're going to do with that money at the end of the month. And then there are medicines that can be helpful too. Nicotine and some other drugs can be helpful at lowering the craving for cigarettes.
You've made me feel very good about knowing that people can manage risk factors and they can improve their health. And if they've got problems that are going to lead to heart attacks and strokes, get busy, have fun, enjoy yourself, get a friendship pattern with exercise, and get a healthier life. Dan Ely, thank you for coming to the Dr. Bob Show. You're always a great educator.
Thank you, Bob. It's been fun.
Wow. So know your risk factors, know what you can do for them. Watch this show, write down those things, work those out with your doctor. Now, we're going to be spending time talking about what are trigger factors that make asthma and chronic obstructive lung disease worse, and the difference between diverticulitis and diverticulosis. We can answer both of those, and it'll also help us keep healthier from that standpoint. You'll want to stay tuned. I want to thank Dr. Dan Ely for a wonderful discussion on risk factors, heart attacks, and strokes. Enjoy yourself, stay healthy, and don't get that heart attack or stroke. Now for questions from you, the viewer, that I think will be important to your health. Question number 1 says, Dr. Bob, what do I have to do to make my asthma better? Well, we call that trigger factors. If somebody's got asthma, that's where the airway goes into spasm, or the inside lining of the airway narrows because of inflammation. So there are medicines that you can discuss with your doctor to get your asthma under control. However, there are things that make it worse. Cold air will make it worse. Sometimes exercise will make it worse. Exercise-induced asthma. We can use albuterol before we exercise. Cigarette smoke, being around secondhand smoke. Air pollution will make asthma much, much worse. So you have to stay inside when there's a pollution alert, and don't be around smokers, and don't let anybody smoke in your life. It will make your asthma worse. If you get infection and sinus infection frequently goes into the lungs. So if you'll take care of those trigger factors, get on the right medications, have routine lung studies to make sure your asthma is doing well, you'll be surprised at how well your asthma improves. Second question, Dr. Bob, what's the difference between diverticulitis and diverticulosis? Well, both of those are colon diseases. When we eat food, it goes in the small bowel, then the large bowel, ends up in the last part of the bowel, of the colon, the sigmoid colon. There seems to be a little weakness in the wall and an outpouching, a little ballooning about the size of the end of your finger. That's diverticulosis. It really doesn't cause significant disease process. A lot of people get diverticulosis. We say you need to be sure that we exercise, that we eat enough fiber in our diet, that we have regular bowel habits. See your doctor and talk about that. Diverticulitis is where there's inflammation in those areas. And that inflammation can be very, very serious. We get cramping abdominal pain, we get diarrhea, we get a fever, we get chills. We can actually get where the infection in the colon will form little fistula, little tunnels of infection that will go into the area and cause scarring. It can be a very serious and very difficult problem. So if you've got diverticulosis or diverticulitis, talk to your doctor. Talk about how often you need to get your colonoscopy. It doesn't increase the incidence of that. Or what to do when you start getting symptoms of an inflamed bowel. It could be cramping, abdominal pain, and bloody stools. So be sure that you take care of those and stay healthy. Well, it's all the time that we have for this show. Let's remember those things that we like to talk about the most. Number 1 is exercise. Exercise, those risk factors for heart disease and strokes. Exercise will help you lose weight. It'll lower the cholesterol. It'll lower your high blood pressure. It'll make you feel better. The runner's high, the exercise high are due to hormones, chemicals that are released from the brain and make us feel better. So remember, make exercise a part of your life. 7.5 hours of sleep. We've got to learn how to sleep. Too many people just don't sleep well. It could be pain, it could be medicines, it could be you don't prepare yourself for sleep, that you're doing too much brain activity before you lie down and go to bed. Relax, rest, settle down, make sleep a fun part of your life. Go to bed at the same time, get up at the same time. If you're not sleeping well, discuss that with your doctor. Eat properly. Watch the portion sizes. Have fun eating. If you have to eat 6 meals a day, eat 6 meals a day. But make them so little that it's not going to add on to being overweight or obesity. So more fruits, more fiber, more plant-related foods. Stay away from fried, fatty foods and from less meats and more vegetables and fruits. And most of all, what is it we like in the Dr. Bob Show? Can't tell you how much laughter will improve your health. If you find time, take time to where you laugh, where you tell jokes, where you giggle, you'll be happier, people around you will be happier, and both will stay healthier.